Is World Lung Cancer Day, and we're raising awareness about the leading cause of cancer death worldwide. Joining us now to discuss Dr. Jason Gonsky, oncologist at New York City Health Hospitals. Doc, welcome. Thank you for being with us. Can you talk about why lung cancer is often deadly compared to other forms of cancer?
Sure. So lung cancer tends to present relatively late after symptoms have developed. So people will often develop a new cough or coughing blood. Or chest pain. And because the lungs are inside the body, we can't see when there are changes happening. In addition, lung cancer, compared to other cancers, tends to grow quite rapidly, and it tends to be resistant to most forms of chemotherapy.
Many people still associate lung cancer primarily with smoking. Can you talk about other common causes, especially in non-smokers?
Sure. Lung cancer does tend to present mostly in smokers, so about 80 to 90% of lung cancers do develop in people who are or were smokers. Among people who weren't or were never smokers, secondhand smoke is the most common cause. There are less common causes such as occupational exposures, radon in the basement, for example, from the soil. So some homes are contaminated with radon. Asbestos is another relatively common cause among non-smokers, and then some people have genetic predispositions.
Some of the early signs that people often overlook when it comes to lung cancer would be?
So a new cough or a persistent cough, coughing blood, chest pain, it can be weight loss, pains in other parts of the body if the cancer has spread. Headache could be another common symptom.
Now, is there a recommended screening test, and who should consider getting it?
So that's a great question. So one of the big pushes over the last 10, 15 years or so is screening for lung cancer. So your primary care doctor has probably spoken with you, if you're an adult over 50, about screening for common cancers such as colon cancer with colonoscopy, cervical cancer with pap smears, mammography for breast cancer. There have been several studies that have shown a benefit for screening for lung cancer in people who've smoked more than 20 pack years. So smoking a pack a day for a year is considered a pack year. So people who have smoked a pack a day for 20 years, who are over age 50, but also relatively healthy. These people have been shown to benefit from lung cancer screening with what's called a low-dose CT scan annually. And with this screening, people are able to identify masses in the lung earlier before they've had a chance to spread when they can still be treated. And this has been shown to decrease mortality from lung cancer.
Doc, is it possible to be relatively healthy if you've smoked a pack a day for 20 years?
It's a great question. So I think relatively is the key. So smoking a pack a day for 20 years certainly can increase the risk of heart disease. It can increase the risk of stroke. It can cause hypertension. It can cause damage to the lungs, such as chronic obstructive pulmonary disease. But quitting smoking is really the best thing you can do if you are a smoker. And if you have smoked over 20 packs, over a pack a day for 20 years and you're over age 50, you should talk with your primary care doctor about undergoing lung cancer screening with low-dose CT scans.
Dr. Jason Gonsky, thank you very much. We appreciate it. Oncologist at NYC Health Hospitals. Thanks, Doc.
My pleasure.
And for all our Health Watch coverage, head over to CBS News.